To be able to walk into an operating room and to be able to walk out knowing that I may have helped cure somebody of cancer is one of the most remarkable professional privileges I think someone can have. But one of the challenges we face is that so many patients are unable to undergo curative surgical procedures for their cancers. Over the years, I became increasingly frustrated with our inability to help the majority of patients who have these tumor types. I began devoting more and more of my time to researching novel therapeutic or treatment approaches to help people in other ways when surgery isn't the best option. What I've really focused my career on now is something called immunotherapy, which are treatments designed to stimulate the patient's own immune system to seek and destroy and attack the cancer. It's very similar to what happens when we have an infection. If we get an infection with a bacteria or a virus, our immune systems will hopefully recognize that virus or bacteria as foreign. It's not supposed to be there. And the immune system mounts a response and hopefully eliminates it. Our immune systems actually have the ability to recognize cancer as something that shouldn't be there and attack and destroy it. The problem is cancer cells have ways of shutting our immune systems off. And immunotherapy is designed to re-stimulate or reinvigorate or wake up the patient's immune system so that it now can fight the cancer and help keep it at bay and even eliminate it. These new treatments are designed to help patients help their own immune systems fight the disease. The advances that we've seen in cancer care in general and immunotherapy in particular just over the last 10 years have been nothing short of extraordinary. When I was a medical student or a resident and we would talk to patients with stage 4 melanoma or stage 4 lung cancer, there was very little positive to discuss with that patient in that clinic room. And today we can talk about immunotherapy drugs that are approved that have very high response rates, where a proportion of the patients, still a minority, but there are patients that can be cured and achieve long-term disease control, which is something we couldn't talk about even 15 and certainly 20 years ago. When I began studying immunotherapy, there was very little belief in it. I would get a lot of strange looks when I told people I wanted to focus my career on immunotherapy, but now it's certainly hit prime time. There are so many approved indications, diseases for which the FDA has cleared drugs being used to treat patients, and so many patients are being helped by it.